All right. This has got to be the biggest group I have had in a long, long time. So I thank the marketing people here at David Carrier in terms of advertising it. I am one of the Ask the Experts in terms of material. And the material today is all about Medicare. So without further ado, am I in the right spot and everybody can hear? Okay, because we have quite a few people on Zoom as well. If you don't mind getting that door, that'd be wonderful. Thank you. I'm going to introduce myself as well as another member of my team. And my name is Nancy Courser, and I work with Cornerstone Retirement Partners. That's the name of our firm. And we are divided into two teams. One is the wealth management side. That was actually started by my husband, Ron Courser. He did a lot of advertising on Wood Radio for a long time on Sunday mornings. People recognize that voice. In fact, it was it was either before David or right after David. And then the other side of the business is the health insurance side of the business. And that's the side of the business that I manage. So with me today is a team member, Amy Orr. So she helped put all the materials together. She also, like myself, is a licensed health insurance advisor. So predominantly our expertise is in the Medicare arena, but just to let you know, we do help with people who are under age 65 as well. So if that happens to be you, we're more than happy to help you with what we call the marketplace or Obamacare. We are skilled in that arena as well, but our baby really is Medicare. And I have been out with David Carrier and coming to these sessions probably for the last 7 or 8 years. I love it. I continue to do it. I will be back in the fall. Amy will probably be the presenter this fall, and that will be during open enrollment for Medicare. Okay. So I wanted to let you know what materials you have in front of you, and then we'll go ahead and get started. So the presentation itself will probably be about an hour. Now, in terms of questions, if you have something that as I'm going through it, you say, you know what, that's a little fuzzy. Could you just please either repeat it or ask your questions so that I can clarify it? I'm fine with that. When it comes to being real specific about your situation, because we're all unique in terms of where we're at, some of you are working, some of you are already on Medicare, et cetera, I will stay after this session and I'm more than happy to answer your questions. We also will offer you, at no cost to you, a consultation, okay? We are paid by the insurance company, so I'll get that out of the way right away, okay? So either I'll stay, answer your questions as it's unique to you, or you can certainly make an appointment and come and see us. I have no problem coming this way as well. In fact, David grabbed me and he said, you know, I need to talk to you about my Medicare. So I'll be out to help him. I'm helping Terry over there. And this is what we do. So I will meet you wherever we need to meet. I do have an office in Canadian Lakes for those of you that live a little bit further north. So the material you have in front of you is very generic in nature. So I am not up here to tell you about a particular plan with a particular carrier, okay? That is against the rules. Medicare is very, very clear on the fact that yes, you can get in front of a group of people and you can present material, but don't be talking about any carriers. They've gone through all of my material and it is acceptable in terms of being able to communicate, relay. All of this material is yours to keep, okay? If you do decide you would like additional help, then we start talking about the carriers and we get very plan specific because now we're really going to talk about what your needs are. What medications do you take? What doctors do you see? What are you really looking for in a plan? So that's when we get more into the nitty gritty. So today it's strictly educational. Again, we'll go for about an hour. If there is something that doesn't make sense, let's get it out there because chances are someone else is going to have the same question. Otherwise, leave the balance of the questions to the end or very unique as it pertains to you. So I have been doing this for many years. I won't even tell you how long. My husband did start the firm and it became abundantly clear when he was meeting with people and helping them with their retirement planning. People said, oh, I'm 64. I'm getting all this stuff in the mail. I don't know what to do. Would somebody please help me? It became very clear that that was an arena that I needed to get into. That was an area where people said, I really do need your help because I have to do something. And you do have to do something. When you get ready to turn 65, you need to decide, am I still working? Am I going to keep my group plan? Am I on Obamacare or a marketplace plan? Well, you can't stay once you turn 65, okay? So we're here to talk to you about the intricacies of Medicare because it is complicated, but I'm pretty good at making it simple. So we'll know at the end because I'm going to ask that you do give me some feedback. If you open the folder, there is an evaluation form. So when you do leave, you can just leave it right at your table and give us some good feedback. We do ask if you want us to give you a call. We'll be happy to set up an appointment. We are not allowed to call you. Okay, I might send you a thank you note, but I cannot call you to say, I'd like to set up an appointment. You must initiate that. And just know that that is the rule for Medicare. Medicare is very protective of you, and they say, nope, you cannot be solicited in that particular manner. You have to reach out and say, I would like some help, okay? So always would appreciate feedback so that I can improve. And if there's something that I've missed, that you can make note of that as well. So as far as the folder, on the left-hand side, it's all yours to keep. You see a brochure with Amy, okay? So she tells you all about Medicare. It's just a brochure just to remind you what is Part A, B, C, and so on. We're going to talk about that. We have Nancy's Nuggets. Nancy is very proud of this because it's taken her many years to put this little baby together. It comes out once a quarter, and it really just updates you on things that you need to know about Medicare, okay? So strictly informational. Product and services, as I said, we connect the health and the wealth. We have a lot of clients that come and see Ron and Nolan. They are the financial advisors. And they also will come and see us during that same appointment. So the idea of one-stop shopping and having everything all in one place is very appealing. We also do help with life insurance and disability and some of the other products, but our specialty really is health insurance. And of course, today we're going to talk about Medicare, but that's just a little bit about us. The other document on the left-hand side is there is a way to try to get yourself out from underneath the calls. So Medicare, we hear a lot of people say, oh, I got a call from Medicare. Oh, I got a call from Social Security. Oh, I got a call from so-and-so, and I have no idea why they're even calling me. There is a way to disenroll and communicate that I do not want you to contact me. So let me ask you this with a show of hands, okay? The first question is, because there's a lot of folks here, how many of you are already on Medicare? Great, okay. How many of you might only have Medicare Part A? Got a few of those too. Okay. How many of you might have a marketplace plan and you're under 65? You're not working anymore, but you do have health insurance. Got that too. Okay. How many of you are working and you have kept your group plan, but you're either 65 or even older, and you don't have any plans to do anything other than keep the group plan that you have? Not, well, we got a few too. Okay, we're going to talk about a few of those variations. That's what starts to kind of make it a little bit more complicated, because when you do turn 65, we strongly recommend that you meet with someone like us who can walk you through the process, because there are things, if you do not do them, you might pay for them down the road. And those are the things that we're going to begin to talk about today, okay? Someone said, yes, it's complicated. It is. And you know what? You got to hear it a couple times. And we have no problems with this kind of situation where we first get started. I've got someone right now I'm working with, and it'll be the 4th time they've come to see me. But every time it was just a little bit more information they needed, and they had some unique questions. So we're not about one and done. We're about making sure that you are very comfortable in understanding what your benefits are. This is important. When you come off of a group plan, this is a brand new type of insurance for you. And for some people, it does take some time to really understand it. I think what makes us unique is that we do offer annual reviews during what's called open enrollment. So we have many, many people that will come and see us in October, November, and December, okay? So that's always available to you when you become a client of ours as well. We have the communication that I showed you over here. There are actually 4.5 bodies that service all of our clients in terms of the health team. So if I wasn't available, you'd call Amy. If Amy wasn't available, you'd call Kristen. So we're there. We have the bench strength in terms of, I got a question, I make a phone call, and we really pride ourselves in answering the phone. Okay. I mean, you know what it's like out there right now. We don't have this giant phone tree. There might be 3, but that's it. So easy to make contact with us as well. Okay. All right. On the right-hand side is what we're going to dig into. So on the right-hand side of the folder, what I'd like you to pull out is, you had my brochure. You're going to want to grab the 2-page document. It says the Medicare Made Simple. It starts with introduction, number 1, and it's got a number of bullet points on it, and it's 4 pages, but we did do double siding. Okay, so everybody's got that. This is my outline. Now, I'm not going to go through it verbatim, but I'm going to go through each and every area so that we've got a good understanding of what the process is. So the first thing is, does anybody know when Medicare came into play? What year? It is. Okay, that's okay. You can cheat. All right. Oh, you can also cheat with the next one. Who was the president? It was. He was part of the Great Society. And he said, you know what? After people are no longer working, wouldn't it be great if they had some health insurance? So they put into play Medicare. It's always had Part A and Part B. It has grown over the last couple of years. So what is Part A? Does anybody know? What is Part A of Medicare? Hospitalization. That's right. What is Part B? Doctor. Okay. Do you pay for anything when it comes to Medicare? What do you pay for? Well, you got those, yeah. You got a premium associated with Part B. Medicare does have a fair amount of out of pocket, and we're going to go through that because some people will meet and they'll say, one, they thought it was free because they've been paying into it all these years. Okay. What they actually were paying into was Part A. Okay. So as long as you've worked at least 10 years or more, you're not paying for Part A, but there's a lot of out of pocket associated with going to the hospital, which we'll talk about. Part B is what everybody pays for unless they're on Medicaid. That's not the topic today. The topic is Medicare. So if you have worked 10 years or more and been paying into the system, you are eligible for your Medicare. If you are a spouse and you didn't work 10 years or more, but your spouse, wife or husband did, you are eligible for Medicare. So I am helping someone right now, that very same situation. She did not work 10 years. She was absolutely thrilled to find out that she could get her Medicare off of her husband's work record. Okay. The other thing that makes this different is we do help you on the front end, meaning that if you are collecting Social Security, you will automatically be enrolled in Medicare approximately 3 months before you turn 65. If you have decided to forego your Social Security, you then have to apply online if you want to take it at 65. So what we offer as a service, if it's determined that, yes, I want to take my Medicare, that's the right thing for me to do at the right time, but you didn't turn on your Social Security, we will help you apply for your Medicare Part A and Part B. So you have to have a Social Security account set up. Do most of you have an account set up that you can see your benefits in? Okay, all right, some do, some don't, okay. But I'll walk through that in a little bit of detail. But again, what makes us different is that we will help you with the front end process. There are a lot of agents that will not do that. They'll only want to talk to you once you have your Part A and Part B. We will help you get Part A and Part B and answer any other questions. I have a good go-to person at Social Security. So when I run into a snag or I'm not sure about how to handle something, she helps us with that, okay? As an agent or an advisor, I am trained to help people. I have to certify every year and take oodles of training, just so that you know. This is not something that you just kind of learn and let it rip. No, every year I have to become very familiar with all the plans. So here's your Medicare and You book. It comes out every October. Some of you have it because you have Part A and B. Some of you have it because you have Part A. It is a good resource document. In the very beginning of the book, They have an index and you can look up, gee, how do they handle flu shots? How do they handle going to the hospital? What is Part A, et cetera, et cetera? What is preventative and what's going to be covered? So hang on to it because it is, yes, it's overwhelming, but for the most part, it's a good guide. At least it's a good place to start, okay? Now, what gets a little confusing sometimes is, well, what is the role of Social Security and what is the role of Medicare? Because they're two different animals, and yet they play together. So Social Security does the enrollment on behalf of Medicare, okay? Medicare doesn't do the A and B enrollment. Social Security does that, okay? And Social Security collects your Part B premium. Either they're going to take it out of your Social Security check because you are currently collecting, or they're going to send you a quarterly bill based on your income, okay? So their role is to get a person enrolled in A and B, or A only, we'll talk about that, and collect the money that supports the Medicare Part B premium. Medicare says we get involved in telling you what's going to be covered. This is a covered benefit or this is not a covered benefit, okay? So if you ever have questions on, I wonder if they're going to cover this type of surgery, you get the codes, you call Medicare. Hopefully your doctor has done a lot of that for you, but once in a while people will say, backing up, you have to be your own advocate, okay? And you know that, all right? You don't want to have surprises. You go to the doctor, they say it is. I mean, you all know your doctors and whatnot, but it's not sometimes a bad idea. We had somebody ask about Prolia. She wanted, it's an infusion for people that have osteoporosis. So we always make sure we don't take anybody's word for it. We want to know. We don't want to be surprised and get a bill for something we didn't expect, okay? But Medicare would assist with that if need be. So they really get involved with, this is a covered benefit, and this is how we're going to process the claim, okay? So it's the claim side, all right? Okay, so we're going to just step back here just a little bit and ask another question, and that is, I kind of saw a show of hands for those on Medicare. Who in the room, not on Medicare, but is going to be turning 65 in the next 6 months? Few hands, okay. Who's going to be turning 65 in the next year? In the next 12 months? Okay. Who's going to be turning 65 a year or more out? Great. So you're planning for that. We do help with that. I have people that will start coming to see us at age 60, 61, and they're like, I got a plan for this. I want to quit working. How do I get individual insurance? How do I bridge the gap between being age 62 and 65? So they'll come in, we'll talk about what we do from 62 to 65, and then we start talking about your Medicare benefit. But a lot of people, they want to know. They want a better understanding because you do have to hear it over and over and over. So keep us in mind. Again, we don't charge for that. At some point, we hope that you will come and say, you know what, you can help me with my supplemental, because Medicare doesn't pay for everything. We're going to offer up some insurance. We're going to make recommendations with your help in terms of how much you want to spend and your needs and all the rest of it. But that's how we get compensated. Okay. All right. So there's that. So Medicare is chock full of what I call enrollment periods. We have what's called an initial enrollment period. This applies to a person who's turning 65. We have a few of those folks, okay? Then we have what's called a special enrollment period. So these people have said, I'm not doing anything over here by taking their A and B, and they are actually probably on a group plan, and at some point they're going to quit working, and they're going to need their Medicare, okay? And the government says, that's fine, all right? Here's the rule. The rule says if you are working, and a few of you are, and you're turning 65, if there are 20 or more employees where you work, you technically don't have to sign up for Part B, okay? So people will do that. They'll come. Terry and I have talked about it in relationship because she works here at David Carrier. But Terry has said, I know that. I don't have to sign up for Part B. I'm still working. But you know what? I'd like to compare if I stayed on the group plan to actually moving to Medicare. Is there an advantage for me to be able to do that? Because once you turn 65, regardless of whether you're working or not, that benefit is yours. So it does behoove you, in my opinion, to take a good look at it and say, I wonder if I should stay on my group plan or should I go? So I will have people that they're getting ready to retire. I had one that works at the Walmart and she's like, I do have a group plan. I could stay on the Walmart group plan, but you know what? I want to be able to walk when I'm ready to walk. I want to be able to give them my 2 weeks notice and have everything in place. And she was eligible at age 65. And that's exactly what she did. And she's no longer there. She just wanted to get it out of the way. It was part of her planning. She looked at it. She said, this is what I want to do. Okay. But again, other people will come to me and say, I've got more than 20 employees on the plan. Okay. I am one of many more than 20. And do I need to do anything? We'll go through the analysis and they'll say, you know what? It makes more sense for me to stay on my group plan than to go to Medicare. Why? Because Part B this year per month is about $174.70 or 40 cents, but I call it 175. It's 175 a month. So if somebody comes to see me and says, well, I only pay 50 a month, or I don't pay anything a month and the plan is halfway decent, you're probably going to stay. But again, you might want some expertise, somebody who does this for a living to walk you through it. Look at the summary of benefits for your group plan and then look at what would it be if I went out on my own, okay? So keep that in mind. So that's called a special election period. We also have what's called an annual election period, and this is for people already on Medicare. You have an opportunity to review your Medicare between October 15 and 12/7, and it's always for the effective date coming up of January 1st, okay? 10/15 through 12/7. You'll see a lot of ads for you, those of you that are already 64, 65, they just bombard you with more and more materials. It's coming in the mail. You got ads on the TV. It's just overwhelming, okay? But this is for someone who's already on Medicare A and B, and they say, you know what, I'm wondering if I'm in the right plan. Is this the plan that has the richest benefits? My doctor, he's no longer working. I got so-and-so as a new doctor. Is that doctor on my plan? So those are the things that we go through with you. This is the busiest time of the year for us. We probably saw well over 600 people. It was Amy, myself, and Kristen. It was nonstop. I worked every Saturday. They worked some Saturdays. You could just about put a cot in there because it was nonstop. And it is for any agent that helps people with Medicare. Not all agents will do a review. We always send a postcard in September and say, if you'd like us to do a review, we're more than happy to do that for you. And about half of our clients will take us up on it. And then when they come in, sometimes they say, nope, I don't want to make a change, but I know what I've got and I can better utilize it because you've explained things to us. Again, you need to hear it. And sometimes there's some new benefits. You might have an over-the-counter benefit that you've never used before. We help you with all of that. So that's called the annual election period. They sometimes call it open enrollment, sometimes synonymous, okay? The other period of time, and I don't advertise it because I can't. It's actually called the open enrollment, not to be confused with this one. And it started January and it ends 3/31. This is for somebody that has a Medicare Advantage plan, otherwise known as Part C. So those of you that are here that are already on Medicare, does anybody know that they have an Advantage plan? Show of hands? Yep, okay, Tom does. All right. So if Tom said, you know what, I don't like what I have, Nancy, would you show me something else? Tom, you actually would have an opportunity. We only have a few more days left here, but it would be effective April 1st and you could make a change, okay? I'm not allowed to advertise it, but the government says we actually have one more time to make a change. You could make it here or you could make it here, but it strictly was for what's called an Advantage plan. So in a moment, we'll talk a little bit more about the letters. You already identified A with the hospital. B was all the medical services. Everybody pays for B, okay? C is what we call an Advantage plan. Does anybody know what a D is? Drugs. Yes, absolutely, okay? So we'll speak about that. The last one on here is called a GEP. Hopefully nobody is there. Here's what a GEP is. A GEP, I can go this way too. GEP, general election period. This is for somebody who didn't pay attention. They didn't do a doggone thing. They're not working anymore. I don't know how they must have been in perfect health, okay? But a GEP requires that you only enroll in January, February, and March. They only give you a quarter of the first quarter of the year, and you pay a penalty. So it's important that you know what you do and when you do it, because if you fall out, and I had somebody like that, she had she was on a group plan with her spouse, and the spouse's employer had 10 people. She said, well, I didn't know I was supposed to do that. Well, they don't look at it that way. So sorry, so sad. She got stuck with the penalty, okay? It depends on how long you've been away, but there is a percentage that they apply. Yep, I think she had a $20 or $30 penalty because she's 70. So it was sizable, and it never goes away. It's every month. So you do not want that to happen. The other thing once in a while people will do is they keep working, okay, but they get all this literature and stuff in the mail, because you do get bombarded, and they sign up for Part B because everything they read says you better do something or there's a penalty. You better do something and there's a penalty. If there are more than 20 employees, you do not have to sign up for Part B. So I will have people that will come to me, and I'll look at it and I'll say, did you realize you didn't have to sign up for Part B? You've been paying for the last couple of years for something that you didn't need to pay for. So very important that you kind of begin to understand the guidelines. So I'm kind of trying to keep the guidelines high enough level, okay? But that's why it's important to talk to somebody who can get into the nitty gritty.
The 20 or more employees on the PERF plan, or 20 or more employees total? Because some people don't choose to be on.
I would say it's 20 or more employees that don't have to be. It's just 20. Could be only 10 on a plan, but there has to be at least 20. Correct. Yes. Yep. Okay. So those are referred to as enrollment periods. Any questions on that? No. Okay. So because we have kind of a variety of things going on here, I'll just point out a couple of other things in terms of people and where everybody's at. So for those of you that are going to be in your initial enrollment period, it is a 7-month window. If you're not on Social Security, you have to do something. So that's when you set up your account. And this is how we help you. You come to us about 3 or 4 months in advance. So let's say that this person has a June 15 birth date. Actually, they weren't born in 2000. They were born in 1959. Okay. So this person comes to us and they say, well, we'd like you to evaluate our Medicare. We have to know their birthday. Okay. So we say, you're not on Social Security. You have no plans to turn it on. Yep, that's correct. We have a 7-month window to make this work. So here's how it works. Here's the birth month. Well, by birth month is 6. The government gives you these 90 days or these previous months, 5, 4, 3, March, April, May, to get out there online and apply for your Part A and B. Or you come and see us with your Social Security credentials. We get into the system with your help. We get you signed up. And what are you going to get? You're going to get Part A and Part B. They always backdate it. Okay, so there's that. So that's how you'd go about doing it. Now, if you are collecting Social Security already, this doesn't apply at all, because over here in the 3rd month, you probably have already gotten your card in the mail. Okay. All right. So in reference to those people that are working, if there are 20 or more employees and you're not on an HSA, which is a health savings account, that's a high deductible account, we recommend, and so does Social Security, that you sign up for A only. And the reason for that is A has no premium. There's no downside to it. And this way you actually get in the Social Security system. or the Medicare system, I should say, okay? So some of you that just have A only, that's what you did. That was perfectly fine, but know that you cannot be contributing to an HSA because there will be a penalty if you've continued to do that. So Medicare says the following as it pertains to health savings accounts. If you have any part of Medicare, A or A and B, you cannot contribute. It doesn't mean that the money isn't yours. It is yours to spend according to the rules of an HSA. But as far as further contributions, once you've moved into the arena called Medicare, you're done as it pertains to the HSA, okay? It's the person on Medicare. If the spouse is not contributing, it doesn't apply to the spouse, correct? It's the contributor, like you just said, yep. Okay, so the other thing could be people that do get their card in the mail because they're collecting Social Security. They could be working for an employer that has 20 or more employees. They don't have to take Part B. So what do? They took their card, and on the back side of the card, they return the card and they give back the Part B. Why pay for Part B if your employer is more than 20? Your group plan seems to be working fine, okay? Because once in a while, again, I will have people who say, I turned my Social Security on, I got my card, I'm still working. And you're like, oh, well, you don't have to pay for Part B. Why give the government $175 every month when you don't need to? So you return the card, you sign it on the back, and then they will remove the Part B from your card because otherwise it shows Part A and it shows Part B. And you know what? I left my giant card, I think, in the car. I got this huge card. But anyway, so no, I didn't. I have it. I forgot it. It's in a piece of plastic in the card. And you might have to do that as well. Correct. So that's Part A and that's Part B, okay, and a little bit more as far as how you get signed up with some of that, okay? The last thing I would tell you is in reference to the special election period. Yes.
Questions.
Sure.
On Social Security, you don't have to go online and go through all the enrollment. They automatically have that information and just send you a card.
They do. That is correct. They have your information. They know when you turn 65 and they send it to you 3 months in advance. Shows up in the mail and you're like, oh, it's either in a brown or a white envelope. And then you got to decide whether you're going to keep it or not. Yep. Do we answer the question? Okay. All right. Good. All right. The other thing here, and then we're going to move on, is the SEP. So for some of you that are still working that might already have Part A, one day you're going to be faced with, what do I do next? Now, there are some employers that offer retiree coverage. There's not as many as there used to be, okay? That is certainly a possibility. We'll help you evaluate that. Sometimes if you don't take the retiree coverage, you're out. They basically say, look, if you don't take it when it's first available to you, it's never available to you. Those are all things that you want to evaluate, okay? Now, do we have any teachers in the room? We have, okay. You are probably eligible for the Office of Retirement Services, maybe, okay? We can help you understand Medicare, but most people, I will tell you that our teachers, they take the Office of Retirement Services. It's very rare I will have someone come and say, Nance, I'd like you to help me. I'm getting out from underneath this. I don't want to take that plan. It's very good, just so that you know that. So the person that says, I have Part A only, I'm getting ready to call it quits, they need to have 2 documents. And again, we help with this. One of them is called the 40B. These are terms that are described by the Centers for Medicare Services. That's the acronym. They're full of all these acronyms. CMS, Centers for Medicare Services. There's a form called the 40B. We help people fill it out. Basically what it is you take your Medicare card, you put the number at the top, and you tell them when you want your Part B to start, which always has to be the first of the month. And you must give Medicare, or I should say Social Security, you must give Social Security at least a 45-day window. And they would probably say they would want 60 days, but they don't want to respond within a couple of days. So you really have to plan accordingly The shortest window would be 45, the longest would be 60, okay? So you go to your employer, the employer's going to fill out a form for you because now you're no longer 65, okay? Let's say you work till 70. There's a form called the L564. It's another CMS form. This goes to the employer, and the employer says you or your spouse, who's been covered by the group plan, has been working from this date to that date, and it will encompass when you turn 65. Because the government says, wait a minute, I had a program, I have a plan here. You didn't take it. Why not? I'm not collecting my Part B premium from you. You decided to continue to work. I'm not getting any money from you. So this L564 has to encompass where you were working when you turned 65. So today is Wednesday. Monday, I met with a gentleman. He had 2 jobs. He's at 68. Between 65 and 68. He had to get both forms. He had to go back to one of his employers, the one he's working with right now, and then he had to go to the one before that. But you have to be able to prove where you were when you were 65. We had another gentleman, he must have had 8 or 9. We had never seen that many, but he worked for it was like a software company that did cyber types of things, and they were constantly changing names and buying companies. I mean, it was crazy how many we actually had to submit. But we work with you on this as far as what are the forms you need, when do you need to submit it. We can actually help you submit them online, and ultimately they end up at Social Security. Has anybody been to that office? It's quite a trip, let me tell you. It is quite a trip. So, but we'll help you with this front end. Okay, so any questions about this, and we're going to move on. Big Rapids is easy. And you know what? You technically can go wherever you want to go. If you want to go to Holland, they're not as busy. Okay, Kalamazoo, I have people that will go there. Your home office for those in Grand Rapids is here, but it doesn't mean you can't go into another office. So I've had people who travel to Florida. They're still Michigan residents, but they work with the Florida Social Security office. But it is the Social Security office you're working with. There's not a Medicare office, okay? All right. Okay, so, yes, sure. Yes.
Is there a glossary for all of those different things? Like, as, you know.
Well,
just because I'm trying to keep up with.
yeah, but I think, yeah,
Just to be able to know what they mean.
Right on your sheet, send me the glossary. I have something, I don't have it here, but no, I do have one. It goes into a little more detail than what you need, but yes, it'll have AEP and it'll have IEP and some of the other letters. So just write on your, and that would be true of anything that you hear here, is take the survey form, whatever we called it here, the evaluation form. If you hear something and you don't think it's in there, just write on there, send me, and that'd be fine. Just write right on there, that would be fine. The list of acronyms would be great. Absolutely. Okay. So now what I wanted to kind of go to is I'm going to talk a little bit more about your parts and pieces and how this is going to work. So the assumption here is everybody has A and B, because at one point in time, you're going to have it. Okay. You have to. No matter whether you're on a retiree plan, you're on a group plan, you're on an individual plan, at some point you're going to get A and B, and you're not going to be working, okay? So let's make an assumption that you have Medicare, A and B. We've accomplished everything. You got a card, you're paying your $174, whatever the extra cents are here, and you're off and running.
Keep your medical benefits, you still have to do Part B?
Well, how would you keep your medical benefits? Do they have a retiree program? Then you could do that. That is correct. But you would have to sign up for A and B. Correct. Yes, you have to pay for B. Maybe. Those are the things that we go through with you. So when you have a retiree plan, just so that you know, that's the government for you, but I get it.
Just said we had a choice if that were the case.
I didn't say that in terms of the retiree plan. So the retiree plan, it says you're no longer working. So when you're no longer working, the government does say You have to have A and B to have a retiree plan. If you're not working and there's 20 or more employees, you don't have to sign up for Part B. She was saying they weren't working anymore. So they're moving away from I'm being an active employee. Okay, right. So you are considered a retiree with a teacher's plan, and you have to have A and B when you turn 65.
I'm not gonna retire for 3 years, so I have to make a choice.
When you retire, then you have to come aboard with B.
So practical mind said, well, why do I pay for this and pay for that?
Well, that's why you want to look at what your options are to see which one is the better option. I'm with you. Okay, we can talk separately for you. Okay, nope. All right, so to continue here, A and B, the assumption is Medicare. I got my card, I'm off and running, I'm paying, everything is good. Okay, now when you first come aboard, there are some important things to consider. So when you either turn 65 or when you first are eligible, maybe you came aboard at 70, okay? The government says you can pick any plan you want. You don't have to worry about medical underwriting or any pre-existing conditions, okay? And for some people, that's very important. So that person is on, I work a lot with pictures and diagrams. That person is going to come down the left side of the diagram because there's going to be two options. There's going to be option number 1, option number 2. And technically, I heard a few people say, well, I got a retiree plan, so you really have another option. Okay, but most of us don't. So my option number 1, I'm coming down this side of the page. This is called a Medigap. Has anybody heard of a Medigap before? Yeah, you have. Yeah, it's got a letter associated with it, okay? It does the best job of filling in the gaps. That's how it got its name, all right? So we're going to come back to that. But what's important to know is that when you first come aboard, either turning 65 or 70, they cannot ask you any medical questions. So we'll have people walk in the door, they're on oxygen, they're being treated for cancer, they got some major stuff going on, okay? They really should take a hard look at the Medigap, all right? Because you can always go from here to here, but you can't always go from here to here. So what is this side? This side is called the Medicare Advantage Plan, otherwise known as Plan C. Now, what you have in your folder here, and we do this when you come in, we actually put numbers on here that are unique to you. But here's kind of my matrix. It's in the folder. That's really kind of what I'm going through, okay? So if you do come and see us, this is exactly what we'll go through. Here's your left side. Here's your right side. Let's talk about what makes the most sense for you. But the first thing to remember here is when you're turning 65 or you're first eligible, first time in Medicare, if you picked a Medigap supplement, you could literally be on your deathbed, okay? They will not ask you any questions. It's against the law. It's against the rules. Once you're in, okay? They can never bounce you out no matter how much they've spent on your care. These particular plans have a letter associated with them. But I am going to back up here because I missed something. And that is this. First, take a look at the blue sheet with me. I jumped ahead just a tad. So if you look at the blue sheet, it says 2024 Medicare cost. Every year, Medicare comes out with a new structure. It generally goes up. It doesn't go down, okay? Goes January through the end of the year. If you come aboard mid-year, they don't prorate anything. Everything you see that's on here is what it is, okay? So what I wanted you to see, I've alluded to it. Part A is the hospital. If you get admitted into the hospital, you're going to have a deductible of $1,632. It's based on a 60-day benefit period. If you're there 3 days, it costs you $1,632. The assumption here with the blue sheet is that all you did was A and B. You didn't do another doggone thing. You said, I'm fine, I'll just take my chances. I'm not adding any other option to it. All I'm going to do is take my A and B, pay for my Part B, and call it good. But here's what happens, though. You go to the hospital, you will have a deductible of $1,632. So technically, if you went to the hospital every 61 days, they would charge you $1,632 each and every time that you actually went. So this begins to point out why people buy supplemental. They're saying, I don't want to be on the hook for $1,632. What additional insurance can I buy so that I can offset that potential expense here in terms of my risk. So if I'm still in the hospital day 61 through 90, now it's $408 a day. Wow. And then it becomes $816 a day for your lifetime reserve. Okay. Very expensive. Again, this is why you have options for how am I going to fill the gaps? How am I going to minimize the overall expense associated with original Medicare? Skilled nursing. I was in the hospital. I can't go home. I need some help. Physical therapy, occupational therapy, all those therapies. You're going to pay nothing for your first 20 days, and then they do a pretty good job of getting you out. But day 21, you're going to pay $204 a day. Okay. So that's hospital stay. You're admitted to the hospital. It's your surgery, your anesthesia, your room and board, your MRIs, your CAT scans, your drugs. As long as you are an admitted patient, it is billed under Part A. Part B, this is where we pay $174.70 a month. Notice it's based on your income. So you look at 2022's income tax and you say, did I file singly or did I file jointly? And if you said, I do file as a joint return, as long as your 2022 modified adjusted gross income was less than 206, you will pay $174.70. That's a month. Okay, that's not a year. That's per month, per person. And it applies to either spouse if they're both on Medicare. You don't have two different numbers. You have the same number. For anybody that has a higher income, you can see how it ratchets up. It's been out there for about 10 years, where the government said, the more you make, the more you pay. Okay? Yes.
Is that like, because they don't say modified, they say adjusted or?
It's on the back side. I have generally there, this might be out of date, but 37, lines 37 and 8B of the IRS Form 1040. So check that. Do you have an accountant or anybody that does your taxes? Ask them otherwise. Yep. So for those of you that are higher income, at this point, all I would tell you is you're going to pay more. And not only do you pay more for your Part B, you get to flip the page and you also get to pay more for your Part D. So if you were at the next tier, you'd pay $244.60 for your Part B. This is for the whole year, okay? Then they reevaluate it because now they're going to look at your 2023 income tax return. They always look 2 years back. If you were the second tier, they're going to add another $12.90 to your premium, and you don't even get a drug plan. All you do is you get a penalty or an adjustment or whatever it is you want to call it. But once a year, they will evaluate it. And the only other thing I'll say now, because I keep talking here, is that if you have retired and you no longer have W-2 income, they are willing to look at this and look at 1 year back instead of 2. And there is a form that you actually can file with them. So I've had people who have said, don't look at 2022. I was working and I had a great big bonus, right? It's 2024. You're getting ready to assess my $174.70. No. I need you to look at my 2023 income tax. I wasn't working anymore. So sometimes people will even get letters from their employer that says they're no longer working, because that's your justification to say, don't look at 2022. I need you to look at 2023, and then they will adjust it. It's total income. It's going to be Social Security and all the rest of it. Yes. Yes. It's going to be business income. Business, no, because they won't make an exception for you. Is your income, was it a lump sum? Okay, we can talk more about that in detail, okay? But I just wanted you to know there are some people that do pay more. There may be a provision to ask for a revisit. So there's your A, there's your B, okay? They don't tell you what to do with D here, but you do have to do something, because regardless of whether or not you take any medications, you need a drug plan. So even if you lowest premium plan, you have to be able to show the government, Medicare and Medicaid here, I did have a plan, I never used it, but please don't penalize me, because again, there's another penalty if you don't sign up when you're supposed to. And signing up when you're supposed to is when you turn 65 or you're first eligible and you decide to take it, okay? So back over here, because I wanted to be able to show you the differences here. So make sure that Nancy doesn't write with the wrong pen. If you write permanent markers on this, you can't hardly get it off. So I want to make sure. Okay. So this is called a Medigap supplement. It's going to do the best job of covering, okay, the gaps. So what I was trying to show you is that the Medigap is going to fill these gaps, okay? All right. And there are plan letters. Again, if you want to talk in more detail, we will. There's some of that information in the folder, but the plan letter that's most popular right now is plan letter G, as in go, okay? And I happen to have G. I'm on Medicare. So plan letter G covers all my out-of-pocket, but I have a premium of about $110, okay? And I'm a little bit more than 65 years old. But it is based on your age and where you live, and if you're a male or a female, okay? So those are all things that we put together for you. If you say, I'm really interested in the concept of filling all the gaps, we know how old you are. We have a quoting tool. We have about 12 carriers that we work with. Blue Cross, Priority Health, Transamerica, Greek Catholic Union, United Healthcare, the list goes on and on. What's interesting is that the rates are not the same for Plan G. So one carrier might be 110, let's say they were 65, and another carrier might be 135. And you know what? You don't get anything different. All you got is a higher bill. So those are the things that we will actually walk you through. In the folder, I guess we didn't have the A through, we didn't do the matrix, right? No. So the matrix, like I say, Plan G is the best plan right now. It does really the best job of filling the gaps. It's based on your age. It's based on where you live and male, female. When you first come aboard, they won't ask you any medical questions, but every year the premium will go up. What we offer as a service to our clients is we will revisit it. And if you can still medically qualify, we can reduce the rate. So my husband's 10 years older than I am. His rate was about $315 a month. And I said, whoa, we got to do better than this. I was able to go through the medical underwriting with all the questions for him now at a 78-year-old male, takes X number of medications, and reduced it to $169. So I saved us more than $100 a month. We will do that for people, okay? And that's part of what we do. And you can do it at any time of the year. It's not just during open enrollment. We're doing it all the time. People will call and say, we just got our rate increase. We think it's too much. We'll talk about what that looks like, and then we'll look at potentially a different plan, maybe with a different carrier. But now they have to answer the medical questions, okay? So the knockout medical questions.
Typically good for 1 year.
No, I woun't say so. No. The carriers will have rate increases at different times of the year, so no. But we can always go back to the drawing board very easily and pull up a quote based on your age. It's very easy, okay? All right, so there's your Medicare supplement. You can travel anywhere in the United States. The beauty of it is you have no network. So you're going to see there's a network over here with an HMO and a PPO. There is no HMO, PPO over here, okay? You get to pick the doctor you want to go to. You can travel anywhere in the United States. Your insurance, Medicare is your primary insurance. Your secondary insurance over here with a carrier name like Blue Cross, Priority Health, Humana, the list goes on. That's your secondary insurance, okay? So when you put your wallet together, you have a red, white, and blue card. You have a supplement card with a carrier that I just mentioned, and you have to have a drug card. Some people don't like 3 cards. Now, to me, it's not a big deal because I know how they all work, but the prescription drug plan, these can be renewed every year during the annual enrollment period. And they should be, because there are people whose medications change, plans change, premiums change. So we say, you know what, call us and let us review your plan so you do not have a surprise, because you don't want to think your plan's going to cover your med. Next year, it's not there. You don't want to think it was a tier 1 this year and next year it's a tier 2 and you got a price that was different than what you were used to paying in November and December. So we have software that we can actually input your meds. We would ask you for that. We want to know what pharmacy you go to, and we come back with a recommendation. There's probably about 8 or 9 different carriers, and they all have a couple of different plans. So, but it is based on your medication mix and where you want to fill your prescriptions. So there are preferred pharmacies, there are standard pharmacies. A lot of the medications that are tier 3, which are brand name medications, are things like inhalers, Eliquis, Jardiance, some of the more expensive medications, they're going to be tier 3, and you will pay more for them, okay? These plans also have what's called an annual deductible, most of them. It's $500 and some dollars. Where people get a little thrown is, whoa, I saw the $545 figure. Does it apply? It only applies to a certain tier. So when we go through the analysis with you, if we find out that all your meds are tier 1 or tier 1 and tier 2, it may not apply. So we go through that in great detail with you so you have a much better idea. What is it going to cost me for the year? What do I pay for this? What do I pay for that? We will break all that down for you, okay? So that's your prescription drug plan. You can review it once a year. Yes.
Is that cost like different for different, I'm gonna take me for instance, I have the Humana Walmart plan, and like that's like $35 a month.
I have the same one. Yep.
Is that, it's gonna start this year, it's $35 a month. Does that apply to the other drug, insurances as well? That price?
No, so they're all different. This year there was a plan that had a 0 premium. We've never seen a 0 premium. So we were putting people in it that had no meds. It's like, hey, take a plan, 0. Don't have an idea what will happen next year. It's doubtful it'll be 0, but time will tell, right? But no, they go up as high as $100 and some based on the kind of medication that you take. Yep, good question. Yes.
As you're going through, my dad's in assisted living, and all of his medications have to be individually wrapped now. It can't be a bottle. Can you go through and find out that information as well on if that's covered?
You know, I don't know. I mean, I've heard of it, but I don't know how they dispense all of that, where they actually do that, if there's a fee that's associated with it. You could write it down on your sheet and I will be happy to investigate it for you. But when you get into assisted living, you can make changes actually once a quarter, okay? And you have to work with the pharmacy that they have there. You generally don't have a choice as to where you get to go. So there are some other dynamics. So I can't answer that without doing a little more research. Okay, no, did you have one?
0 drug.
Sure.
I noticed that, and I noticed that it was kind of a sketchy looking provider. So I went with something that was maybe 5 or 6, I don't know.
And that's fine. And people will do that. I agree. And you know, some of them too, and I know which one you're talking about, they have a call center. And you know, sometimes you end up in India and you have a hard time understanding these people. So sometimes it makes sense yeah, I'm with you. It's definitely worth it. It is. The Part D plans themselves too, just so you know, the government dictates that all medications must be resident there to treat any and all ailments, okay? I should probably have said it a little different. The government says you must be able to treat any and all ailments. You decide, Part D company, what medications you want to put out there on your formulary. So every once in a while, there'll be a new medication and not everybody will cover it. Again, and that's a good reason to do a revisit, okay? Eliquis, now this goes back a number of years. My mom is on it. But I couldn't find a plan right away to find the Eliquis to be covered. Because if it's not covered on the plan, you pay the full price for it. So again, that's a good reason why to have somebody just periodically check it. If you just have generics, it's probably not as big a deal. But if you're spending a fair amount of money on your medications, you want somebody to look at it and to walk you through it once a year and go through that with you. Okay. All right. Okay. $35. It is. It's capped at 35. Yep, we'll talk a little bit about that too. We'll come back to that. All right, so we're going to move to the Advantage plan. So the beauty of this one is really you got flexibility. You can go to any doctor that takes Medicare. You can travel anywhere in the United States. Yes, it does go up, but if you stay pretty healthy, you can revisit it and you can lower your premium. I liken this a little bit to the cable company. Once they got you, right? Okay, that's why you have to make an effort to go back to an agent and say, I think I'm pretty healthy. We show you the questions and then we decide whether you should move forward. The Medicare Advantage, very popular. A lot of people are moving to the Advantage plan. We've had many people start here and then they went here, okay? So the Medicare Advantage plan, you have medical, you have Part D, and you have what I would call extras. So here's my medical, here's my Part D. It's all one-stop shopping. Now, you still have to be an A and B. You still got to pay the $174.70. You don't escape that. It combines A and B. It takes the blue sheet and it says, I'm going to do some better things for you here. So the Medicare Advantage plan is just like the Part D. It can be reviewed and renewed every year. So there's your AEP. And when you're over here and you're looking at the medical benefits of an Advantage plan, many of them this year are zero premium. I've never seen that. I've seen zero, but not as many as I saw this year. So many people move to a no premium plan. You still have the $174.70. You don't escape that, but they started out with zero. But everything is a copay with the exception of the primary care doctor. So I go to the specialist, it's 35 or 45. And it's every time I go to the specialist, I pay. I now need outpatient surgery. It's going to cost me $290. I now need to go to the hospital and they admitted me for 3 days. I'm going to pay $900 because it's $300 a day. Okay. So if you don't have a lot of medical services, it works like a charm. If you come and see me, especially during open enrollment, we have a crystal ball and we look at it. We're like, oh, I wonder what it's going to look like for next year, because you don't know. But that's why it's important that you understand how these work, because if you start here, you can always go here, okay? And if you're okay with this, just understand that if you have a bad year, you do have a safeguard, and the safeguard is referred to as a maximum out of pocket, a MOOP. The average maximum is about $5,000. That's your money. And once you hit the $5,000, you don't pay anything for the rest of the year with your copays and your deductibles and that type of thing. It does not include drugs. Yes.
Does the Advantage plan, this is one that I understand affects the zip code we live in as to whether or not you can get it.
It's based on your zip code where you live in your county, correct? Yes. Okay. Okay. And that's possible. Yep. Maybe next year it will be, but that's possible. Oh. Okay. Okay. I drive through Montcalm on the way to Mecosta, so I do understand that.
Not that I want.
Right, but it isn't there. And it is based on your zip code and it's based on your county.
The reason that I was given is because of probably the more people that are at work and
Based on unemployment.
they base it on unemployment. And Montcalm County is very high unemployment.
And I think it's also based on hospital and medical care and the cost of and so on and so forth. But I've heard that before.
And
Yep.
the other thing of the question I had too is, I understand, correct me if I'm wrong, but I did understand that it was very difficult if you're on the Advantage plan, if you decided you wanted to go back to the Medicare plan. I had gone through a class years ago and they said that was not possible. Has that changed? Obviously, that you can get off that and go back to Medicare?
So here's what happens. No, it really has not changed, but it all depends on your health. And you might be surprised, we have worked with people who I would have thought were unhealthy and might not have qualified, and they did. So what we do is every carrier has an underwriting guide. So we ask you information about you. Do you have diabetes? Do you have? So we try to ferret some of that out beforehand. Every carrier has what they call knockout questions. So if you already have a handicap sticker and you were here and you had a handicap sticker, no, they will not take you over here. There are a lot of companies that say if you're here and you have had AFib, you're not going to get over here the second time. There are some companies that say you're on a CPAP machine, you want to go back over here, we're not going to take you. So it all depends in terms of your medical history. So you'll always have an option here, and there are multiple plans here. They're not all zero. So my mom is in a $78 plan. So for the $78, she's got lower copays. Okay, let's talk further on yours, about yours, because I want to try to get through this for everybody right now. Okay, so it is more like a group. It is more like a group plan because people are familiar with the copay concept. What is different though is you don't have to satisfy a deductible of thousands of dollars to use your plan. You know, a lot of the group plans today say you got a $500 deductible, you got a $1,000 deductible. You don't have a deductible to satisfy. This is different than a deductible. So if you said, I'm going with a zero, first time you went to the doctor, primary care, it wouldn't cost you anything. So you're not satisfying a deductible to start to use your plan. That's a big difference, okay? But this is more piecemeal, okay? Pay as you go. They change every year. Your Part D, your medications, they're going to be built right into the plan. We do the same kind of analysis if you want to see what it's going to cost you, okay? And then these extras are things like dental, vision, and hearing. It's all preventative. You get an over-the-counter benefit, which is a card that you can use at a grocery store or at a Walmart or a Walgreens. And you can purchase items like Band-Aids, vitamins, Pepto-Bismol, items such as that. That has been a big deal, the over-the-counter. Now, not a lot of people use it because they don't know how to use it, but you'll hear about over-the-counter, and the gym membership is over here. And it's called Silver Sneakers, okay? So it's one-stop shopping. An Advantage plan is managed care. Everything goes through the carrier. They're going to manage your care, okay? Whereas this isn't really managed care, okay? So sometimes people get a little bit disturbed over here because they might have to jump through another hoop, okay? Because they got a prior authorization that they have to obtain. So you have to work with your doctor. They're going to manage your care. We have to make sure your doctor's in the network for the plan, okay? We do all of that up front with your help. We do all that verification to make sure HMO, PPO is the doctor. You can also travel worldwide with these, okay? That's a big deal now. You can go anywhere in the world. So if it costs $120 to go to the emergency room here in Grand Rapids and you're in Paris, France, you fall off the curb, $120 to go to a hospital there. It's the very same, okay? So the Medicare Advantage plan, there's a whole lot more of these than there are here. In terms of when you compare, the biggest things are, do my doctors participate? Are my drugs covered? Do I see value with the extras that I think I will use them? You pull the trigger and you're good for the year. So any questions about the Medicare Advantage plan? Yes. No, I've had maybe a dozen in the years that I've done this. But no, I see much more movement from here to here. People will say, I don't want to pay $100 a month. I only go to the doctor 3 times. I'll take my chances. I got $5,000. This is my worst possible outcome. So what if you end up having cancer? Yes, it's probably going to cost you $5 grand by the time it's all said and done. Chemotherapy goes through the Part B of Medicare, doesn't go through the Part D. It costs you 20%. So it won't take long. If chemo is 10 grand, I don't know what it is. So there's $200, right? $2,000, I should say. So all of this $2,000 goes into the MOOP over here. So that's when I see it. is when somebody says, I have had cancer, I had to have chemotherapy, I had radiation, I had surgeries, I had all this other stuff. But you know what? They might have had just one bad year. In the other 9 years that they've been in it, they only spent a couple $100. So back to the crystal ball, right? So you just have to know what it is. How is it going to work? If I travel, how is it going to work? If I want to make a change, how is it going to work? So those are all the things that we try to make sure that you understand, okay? So all your preventative services go through Part B, your flu shots and your colonoscopies and all of that kind of stuff. And did I miss anything, you think? Did pretty good? Okay. All right. Okay, I'll explain that. And then I do want to talk just a little bit about Part D, and then we're done. So what Amy was talking about over here with the Medigap, if you go with Plan G, the only out-of-pocket the only out-of-pocket first, and I have G, so the first part of the year I have to satisfy the deductible of $240, okay? So once I satisfy the deductible of $240, then I'm subject to the Part B 20%, because Part B is generally Medicare pays 80, and I didn't tell you that, but generally Medicare pays 80, you hear that on TV a lot, and you're going to pay 20%. So with a Medigap G or F, it's going to pay the 20%, okay? But again, I have G, I pay my $240. I have an envelope at home that I put my $240 worth of bills in, and then I don't pay anything else after that, okay? All right, so that was the 20% over there. The only other thing I wanted to mention is that the government is finally taking note of the fact that the medications for many, many people are very, very expensive. I mean, there are people that have decided, can I fill my script? And we've met them. I take it every other day. I go to Canada for my medications because everything is so expensive. So there is a sheet we put in here. It's a timeline, okay? So I just wanted to review the timeline with you. It's on the right-hand side. So I'll let you grab that. Okay. So the Part D, 2006, the government said we need a drug program. So it's been around for a long time. When it first came aboard, they had something and it's still intact. It's called the donut hole. So it's otherwise known as the donut hole or the coverage gap. And basically, the long and short of it is after you've spent a certain amount of money, and they keep track of it and they tell you where you are in relationship to the donut hole, you are going to find yourself paying a whole lot more. So there were two diagrams. There's actually this one here and there's this one here, and they kind of go hand in hand. And we are coming in for a landing, so I apologize for going over. We're still good on the Zoom? Okay. And you do that you want me to answer. Okay, and again, thank you. But here we go, we'll wrap this up. So this document right here shows you the current drug model. And if you read through it, it basically says at the very bottom, member pays a Part D premium. So this person pays. This person doesn't pay for the D because it's embedded. Okay, so they don't have another premium. The person might have the $545 deductible depending upon what tier their medication was. But when they get into phase 2, they're going to have a copay. So I'm going to use Eliquis as an example. My mom is on Eliquis. It's a $500 retail drug price. If she didn't have any insurance and she tried to buy it, it's going to cost her $500. Her insurance says, nope, we're going to sell it to you for $42 every month. But in the meantime, she's paying $42. The $500 goes through the cash register. 500, 500. She's filling it every month now. 500, 500, 500. Well, once she hits 5,030, right? So that's a little bit more than 10 months. So she went 510 months. She will go from paying $42 to paying 25% of the 500. That's what you see there under phase 3 called the donut hole. So people will often say, I couldn't believe it. I went to the pharmacy. I was so used to paying $42. They didn't look at, because I think it's once a quarter, you actually get a worksheet that will show you how much you've spent in your drugs and where you are in relationship to the donut hole. But they're there and they're like, wow, look at this. I just went from $42 to $125. So my mom in this example would pay for November and December, the additional dollars, and then in January it resets and it all starts over again. Okay, so that's how that works. Now, the government has said we need to do something about it. Interestingly enough, back in 2006, the government didn't have the ability to negotiate with the pharmaceutical companies. They got to write the tickets and tell us what they were going to charge and so on and so forth. So the government decided that under the Inflation Reduction Act, which you've all heard about, and I'm not sure that we really have inflation reduction, but they bury all these things in it, right? Well, this is one of the provisions. They said, we are going to do something about this. First thing is, we're going to tell the manufacturers and the pharmaceutical companies, you will play ball with us and you will negotiate with us. And if you don't, we're going to penalize you, okay? So they're coming to the party. When you look at the timeline here, in 2023, they've made changes. So here's the $35 insulin that was mentioned before. If the company, the drug company might have to pay a rebate if the drug prices rise faster than inflation. So they've got numbers that they're measuring it against, okay? 2024, the year that we're in right here. Okay, so what did they do? It used to be there was one more level at the top here called catastrophic, and it's gone away. They eliminated that altogether. That person had spent about $8,000 in all of their medications, in their copays. They kept track of it all. The government said, nope, we're getting rid of that altogether. That was the first good thing that they decided to do there. That was 2024. They also expanded the eligibility for low-income subsidy. That is a program available to people whose income is lower. Okay, I don't have any worksheets on it, where the government will help in terms of offsetting the costs. But here's the big one. Next year, nobody really knows how it's going to work, but in 2025, the government is going to cap that out of pocket to $2,000. And we have people today that pay $4,000, $5,000, $6,000 for all their medications. And the government is saying, nope, you're only going to pay $2,000, but nobody really knows how they're going to administer it. It's going to be a big deal this fall as far as how they're going to go about doing it. The other thing they're going to let people do is, imagine you go into the pharmacy and they want their $545, right? Very first time you went in, tier 3, inhaler, you owe me $545. The government now says, we're going to allow you a payment plan. So you can't pay it all in January when you need to pick up your inhaler. We're going to make arrangements for you to spread it out over the course of 12 months. But nobody knows who's going to do the collecting of any of that. Nobody knows if it's a credit card. Nobody knows how they are going to figure out how to do that. So really be on the listen and the lookout for, this is going to be a big deal. The other thing that people are concerned about is, because they're going to make it $2,000, right? Is what's going to happen to the premium over here. So that zero well care premium, maybe it goes to $55 to offset all this other stuff. So we have no idea what's going to happen here. It's going to impact this to some degree, but we don't know exactly how that's going to work either, okay? But it's got to go someplace, that cost. So I don't know who's going to eat it, but it'll be, you wonder how it's all going to work. But it's supposed to be 2,000. Be on the listen for it. We'll know more later on as far as how that part of it's all going to work. It's 2,000 per year. Yes, correct. The government also is negotiating with these companies 10 drugs. And they're saying, you got to get your premiums down. You got to get not premiums. You got to get your copays down, da-da-da-da. Eliquis, Jardiance, Xarelto, Januvia, Farxiga, Entresto, Enbrel, Imbruvica, never heard of that one, Stelara, and then Fias, Novolog, the pens that are Novolog, so on and so forth. But anyway, they have identified the top 10 that they're working with the pharmaceutical companies on. And you will see also some reduction for these 10 drugs in the next couple of years. And they're going to take these 10 and then they're going to tackle another 10 and so on and so forth. But it's all under the inflation, what's it called? The Inflation Reduction Act. It doesn't even make sense that they call it that name, but they didn't ask us. So anyway, listen, I'm coming in for a landing. I went over. I thank you very much for staying. So I hope this was helpful. It's a lot of information. I understand that. Okay. Everything in your folder will be helpful when you review it. If you don't want to review it and you want to come and see us, we're certainly willing to do that. We have an office. It's over there in Centennial Park. It's on 28th Street. It's across from the Walmart that I made reference to. And we have 3 of us that do exactly this and walk you through this same type of format, but we're going to personalize it. So we're going to ask you for your birthday. We're going to ask you for your meds. We're going to ask you for your doctors, and we're going to walk you through it. If you're getting ready to call it quits, give us some time. And if you're getting ready to turn 65, give us at least 3 or 4 months for planning purposes, okay? The more time you allow, the more you can better understand the change that you want to make. Most of the time, it's 2 appointments. The first appointment is we get to know each other. What are your needs? And the second one is a recommendation. We would recommend this approach. Some people say, I don't know. We recommend, we'll show you both. We'll walk you through them again, making sure that you understand if you start here, you can go here and vice versa or whatever the case, and just kind of reiterate everything for you as well, okay? I make a fabulous cookie. It's right up there with David Carrier's cookie. I've told him that before. It is oatmeal raisin with white chocolate, cup of coffee. Come in and see us. And our hours are generally 8:30 to 4:30, but I often work in the evening because people are still working. We can do Zoom, we can do a phone, we can meet face to face, you know, really whatever's easiest for you. So was this helpful? Yes, good. Okay. Did I miss anything? I'm sorry. And we do have some questions, and we have some questions back there. Please fill out the survey while we're kind of talking here, because I'd like to be able to get your feedback. Yes, please tell me about the questions. Well, it was. Yes. So in repeating the question, the material was emailed yesterday to David Carrier, and then I believe it was forwarded. If it wasn't, I apologize, and just let us know, or call you guys and say, I'm sorry, I didn't get the email, and we'll send it right over. But absolutely.
You can't contribute to the HSA, but can you contribute to the flex spending?
Correct. So to differentiate that, so the question had to do with an HSA versus a flexible spending plan like an FSA. They're 2 different animals. You can keep contributing to the FSA. No issues there whatsoever. If you are still working and you want to contribute to the HSA, here's a little twist. You can continue to do that. But what you have to keep in mind is the following. So the assumption in that example is person is on the HSA. They're not planning on retiring. They want to continue to contribute. They have to stop the HSA 6 months before they're ready to retire. So as long as they can back into it, they go to HR and they say, HR, I'm thinking about retiring, or you don't even tell them, that's your business. I want to retire here in 2025, or I'm thinking about it. Could you help me? And then they can turn it off here in June. But you have to back it off 6 months prior. Why? Because when you apply for your Part A, this assumes this person did not have A or B. They backdate it 6 months. Okay, so what you really want to remember with the HSA is if you continue to keep working, go ahead and contribute, but you must stop 6 months prior to your departure and in needing your Medicare plan. Any other questions? That was it. Okay, any other questions here from anybody?
Question about backdating it, the 6 months, part A, are you paying for part A, you paying for part B?
Right, you're not paying for Part A. That is correct. Yep, and anybody that has only Part A, remember, if you do go to the hospital, give them a card. Show them the card. There might be value in the card. You're going to have your group plan, and then you would have your Part A card. Okay? All right. I want to thank you all. I'm so sorry it went over. We teach a class in Rockford. If you ever want to do a review there, we do the very same thing, but we take 2 nights because there is so much material, and Amy teaches that class. So it's a community ed class. I do go to the senior centers as well, and I help people there. So thank you all so much for coming, and I'll stay after if you have any other questions. Otherwise, leave your evaluation form. We'll pick those up, and have a good night. And hopefully the traffic's better on your way home.